So let me introduce to you. This is Mohit. Mohit is 34.
34, sir.
Mohit's age is 34, and he works in the university as a hospitality manager.
Right.
Would you tell us कि क्या हुआ था, कैसे problem?
So actually, on the date of 18th December, I feel little pain around my anus area.
18th of December.
18th of December, I feel little bit pain on around the anus area. So initially, I took it casually. I thought it's just a normal thing, and I took some medicines from the local medical store, but I didn't get relief. But on the date of 25th, it was like immense pain.
25th तक बढ़ गया था.
Yeah, unbearable हो गया था 25th तक. And on the date of till 29th, I was unable to walk, unable to sleep, unable to sit.
And there must be some fever also.
It was a little bit of fever
bit of
also,
fever.
yes. And then in the 29th night, or on the night of 29th, I got a little bit of blood
Discharge.
the blood discharge from my anus, around the anus area.
And the pain must have become a little lesser.
Yes, sir. Yes, sir. And after that, after 1 week, मेरे को काफ़ी अच्छी तरीके से नींद आई. After
the leak,
I got like
the next day.
And but again till 30th morning, the pain was the same. So
That's when you decided to
come here, sir. Yes, sir.
Well, you see, I don't know why you waited for these 10, 12, 20 days and, bore that kind of a suffering.
Yes, sir.
The earlier you go to the doctor, the better it is.
Right, sir.
Still, you came in, let's say, 20 days time, and the day you came, the next day we took you up for surgery because
Right, sir.
it was a perianal abscess which had formed a fistula.
Right, sir.
This is how fistulas present. Initially, they form an abscess, then they burst, and then people think that because ab to theek ho gaya.
Right,
So you came, and because the pain had recurred, but had you not come and thought that theek ho gaya, then this fistula would become more and more and more and more complex, and it might have become a high fistula. There are grades of fistula, 1, 2, 3, 4, 5. So जितना ग्रेड बढ़ जाता है उतना ही कॉम्प्लिकेटेड ऑपरेशन हो जाता है.
Right, sir.
So you came 20 days and we could manage you, and in 1 day's time you were home.
Yes, I got discharged on the next day, sir.
The next day you
Next
went
day,
home, and you were, as good as normal from the day one. The pain went away.
After the operation, the pain which I have had like before the operation and after the operation, it was like nothing in terms of comparison. It was nothing.
So there was no pain of surgery.
No pain of
really,
surgery, nothing.
And the pain which you had of abscess went away.
Right, sir.
And you have been back to work and you're doing well.
And
And your wound has almost healed.
Yeah, it's like I took some rest, but otherwise within like 4 to 5 days I can be back to work. Right. Yeah.
Actually, you took rest because surgery has been done, and psychologically you feel.
Right, sir.
You see, these days the gadgets which we have, call them laser, call them ligashore, call them whatever. But when you go to a doctor, you leave it to his wisdom. Do the
Right,
best
sir.
for me, and we decide what is good for you.
Right, sir.
And we did it, and you see it's successful. But suppose you had spent 6 years
Right,
coming
sir.
to us, then the surgery would have been far more major.
Right.
And then you can't say that मेरी surgery इतनी बड़ी हो गई और 2 महीने लग गए ठीक होने में. Then sometimes we have to raise a flap and cover this area. It becomes so big.
So big.
Any questions you have, Ritu ji?
Just one question. मेरा तो सर अभी भी यही एक सिंपल सा मुझे समझ ही नहीं आया. पहले तो हमने ये टर्म ही पहली बार सुनी थी.
Fistula.
Yeah.
You know, people come to us saying कि मुझे piles है.
हाँ. We were thinking
Everybody calls it piles. Anything in the area of anus is called piles.
piles.
मैं इससे पहले अभी मैं एक पेशेंट को देख रहा था, उनका कैंसर था. वो आए यही कह के थे कि मेरे को पाइल्स. सो जब हम पाइल्स के साथ आते हैं पेशेंट्स, तो हमको देख के पता चलता है टू अ सर्जन. आम देसी को नहीं पता चलेगा. वो तो हर एक को पाइल्स ही पेशेंट समझेगा, वो भी देसी भी आदमी पाइल्स का ही इलाज करता रहेगा. And the previous patient who came to me, 1 साल के बाद आए वो कैंसर के पेशेंट, एंड वो कैंसर बढ़ता गया. सो पाइल्स जिसको आप कहते हैं वो या तो हेमरॉइड्स हैं, या तो फिशर है, या तो फिस्टुला है, या तो कैंसर है. Any of these 3-4 things it can be.
Right.
So it's better, it's wiser to come to a responsible, educated doctor.
Right.
You find out these days, educated people can always find out on Google.
Right, sir.
Who should be my doctor? Most people come to me looking at Google. Maybe you also had
Yes,
come to
yes.
We also.
because Google is the greatest source of knowledge these days.
Right.
And whatever we do is visible to Google,
Right, sir.
isn't it?
So इसका मेन सोर्स लाइक होने का क्या है? जैसे अभी मेरा हो
Current
गया
guy,
हमका
it is pretty common, my dear. It's pretty common. If I may confess, I've also had once. My student only operated on me, and my student also has had it. I operated on him. So it is not so very uncommon. एक बाल तोड़ जैसी चीज़ ही तो है ना,
जी.
पर जो वो एनस के अराउंड होती है तो वो बढ़ के अंदर भी खुल जाती है, बाहर भी खुल जाती है. इस रास्ते को हम फिस्टुला कहते हैं. सो दिस इज वेरी पेनफुल.
तो इसके अगेन होने के चांसेस या उससे कैसे बचा जा सके?
जितना आप लेट आते उतने रिकरेंस के चांसेस बढ़ जाते.
बढ़ जाता है.
जितना आप जल्दी आए हैं उतना रिकरेंस के चांस निल है. आप जल्दी आ गए हैं
Right.
एंड वी हैव बीन एबल टू एडिक्वेटली ट्रीट यू. रिकरेंस के चांसेस 0 है, निल है. मगर रिकरेंस को समझिए. रिकरेंस डजंट मीन ये वाला तो रिकर नहीं करेगा, मगर जैसे ये हुआ ऐसे ही दोबारा भी किसी को भी हो सकता है.
राइट.
It will not be called recurrence. So कभी भी कोई बाल तोड़ तो हो ही सकता है ना. Actually, stress is the cause of most of the problems. So we should learn to live a stress-free, happy life.
राइट.
Stress थोड़ा कम करें. Go slow, go slow. Work efficiently and expect less. Work efficiently, expect less. We expect more, but we don't work as efficiently and as dedicatedly. Isn't it?
Right, sir.
Put in your best and don't expect any returns. वो तो आएंगे ही,
बिल्कुल.
है ना? So that is the way to lead a more stress-free life. अपनी मेहनत पूरी लगाते रहो, expect कुछ करो ही नहीं. Stress-free life.
राइट सर.
है कि नहीं?
राइट सर.
So all the best, my dear.
थैंक यू सर.
You are fine, so you are free to lead a normal life.
थैंक यू सर.
उस मिर्ची खाने से ये सब कोई प्रॉब्लम नहीं. सब कुछ खाओ,
खा सकते.
राइट सर.
एवरीथिंग. इसबगोल ज़रूर ले लिया करो.
जी.
फाइबर की डेफिशिएंसी है हमारे खाने में, ठीक है. सो डू टेक इसबगोल. लिटिल वन की भी एक पिक्चर ले लो. लिटिल वन इज कीपिंग अस लाइवली एंड cheerful. Thank you.
थैंक यू सर.
Okay.
थैंक यू सर.
Bye bye, my dear.
थैंक यू सर.